Welcome to the breastfeeding promotion and support in a baby-friendly hospital. Session 2, Communication Skills. Objectives for this session: identify communication skills of listening and learning and building confidence. Practice the use of these skills. Communication skills. Often health workers are trained to look for problems and to fix these problems. Good communication means that you respect the woman's own thought, beliefs, and culture. Does not mean that you will tell her or advise a person what you think they should do and push a woman towards a particular action. Health workers need to be able to do more than just offer information. It is a part of their job to help mothers look at the cause of any difficulties they have and to suggest courses of action that can help fix the problem. You can use communication skills to listen and learn about the woman's beliefs, level of knowledge, and her practices. Build her confidence and praise practices that you want to encourage. Offer information. Suggest changes the woman could consider if changes are needed. Arrange follow-up with her. You can also use these skills to communicate with coworkers who resist changing their practices towards baby-friendly. Communicate with family members who are supporting the mother, especially those that may have negatively influenced her feeding practices with her baby. Communicate with policymakers to advocate towards baby-friendly workplaces. Skills to listen and learn. Communication can be what we say. This is the verbal communication. Equally important is nonverbal communication, the body language that we use and what we observe of the mother's body language. When you talk with mother in a place that is comfortable and where she feels safe, this helps her feel more like talking with you. Use helpful nonverbal communication. Our nonverbal communication to the mother can help her to feel calm and able to listen. Some ways of providing helpful nonverbal communications during a discussion with the mother are: sit at the same level and close to the mother. Remove any physical barriers such as a desk or folders of papers in your arms. Pay attention to the mother. Avoid getting distracted and show you are listening by nodding, smiling, and other appropriate gestures. Take time without hurrying or looking at your watch. Only touch her in an appropriate way. Do not touch her breast or her baby without her permission. Ask open questions. When you are helping a mother, you want to find out what the situation is. If there is a difficulty, what the mother has done, what worked, and what did not work. If you ask questions in a way that encourages the mother to talk to you do not need to ask too many questions. Open questions are usually most helpful. They encourage a mother to give more information. Open questions usually start with how, what, when, where, why. For example, how are you feeding your baby? Closed questions can be answered by a yes or no and may not give you very much information. Closed questions usually start with the words such as are you, did you, has the baby. For example, did you breastfeed your baby? Encourage the mother to talk, show interest, and reflect back. You can show we are interested in what the mother is saying by using responses such as nodding, smiling, and phrases such as or go on. If you repeat or reflect back what the mother is saying, this shows that you're listening and encourages the mother to say more. You can use slightly different words than the mother used, so it does not sound like you are copying her. Empathize to show you are trying to understand her feelings. Empathy shows that you are hearing what the mother is saying and trying to understand how she feels. You are looking at the situation from her point of view. Sympathy is different. When you sympathize with a person, you are looking at it from your point of view. It is helpful to empathize with the mother's good feelings too, not just her bad feelings. You might need to ask for more facts, but do this after you have found out how she feels about the situation. Avoid words which sound judgy. Words that may sound judgy include right, wrong, well, bad, good, enough, properly, adequate, problem. Words like this can make a woman feel that she has a standard to reach or that her baby is not behaving normally. For example, is your baby feeding well? Implies that there is a standard for feeding, and her baby may not meet that standard. The mother may hide how things are going if she feels like she will be judged as inadequate. It is more helpful to ask an open question such as, how does your baby feed? Or, can you tell me about the baby's feeding? Your communication skills can help the mother to feel good about herself, confident that she will be a good mother. Confidence can help a mother to carry out her decisions and to resist pressures from other people. To help build a confidence and support, we need to accept what the mother thinks and feels. We can accept a mother's ideas and feelings without disagreeing with her or telling her there's nothing to worry about. Accepting what the mother says is not the same as agreeing that she is right. You can accept what she is saying and give correct information later. Accepting what a mother says helps her to trust you and encourages her to continue the conversation. Recognize and acknowledge what is right. Recognize and praise what the mother and baby are achieving. For example, tell the mother how you notice that she waits for her baby to open his or her mouth wide to attach. Or point out how her baby detaches himself or herself when he or she is finished feeding on one breast and ready for the other breast. Give practical help. If the mother is comfortable, this will help her milk to flow. She may be thirsty or hungry. She may want another pillow or for someone to hold the baby when she goes to the washroom or to the toilet. Or the mother may have a clear practical breastfeeding problem. For example, that she wants to learn how to express her milk. If you can give her practical help, that she will be able to relax and focus better in her baby. Provide relevant information using suitable language. Find out what she needs to know at this time. Use suitable words that the mother understands. Do not overwhelm her with information. Make suggestions rather than commands. Provide choices and let her decide what will work for her. Do not tell her what she should do or must not do. Limit your suggestions to one or two suggestions that are relevant to her situation. Arrange follow-up and ongoing support. Often when the discussion is over, the mother may still have questions. but there was not time to discuss. She may think of something else we wanted to talk about, or she might find it difficult to put a practice into it. It is important to arrange follow-up and ongoing support. Learn what help may be available from her family and friends. Offer a time when you will see her or talk with her again. Encourage her to see you or another person for help if she has doubts or questions. Refer her to a community support if possible. Refer her to a more specialized counseling if needed. Many women are not able to do what they want to do or what you may suggest they do. A discussion needs to consider the women's situation at home, family members, the household's money and time, the mother's health, and the common practices in the family and community are important influences on what a mother can do. Remember, you should not make the decision for the mother or try to make her do what you think is best. You can listen to her and build her confidence so that she can decide what is best for her and her baby. Session 2 Summary. Communication involves listening and building confidence and not just giving information. For listening and learning, use helpful non-verbal communication. Ask open questions. Show interest and reflect back what the mother says. Empathize to show that you understand her feelings. Avoid words that may sound judgy. Building confidence and giving support. Accept what a mother thinks and feels. Recognize and acknowledge what a mother and baby are doing right. Give practical help. Give a little relevant information using suitable language. Make one or two suggestions, not commands. Arranging follow-up and support suitable to the mother's situation.